Is genetics causing your thyroid issue? I want to break this down and talk about the relation and interconnection between genetics and thyroid issues. Let's break them up into two main categories. Number one is thyroid function. How do your genetics influence thyroid function? They do. They influence your ability to absorb and utilize iodine. They can be influenced by your DIO genes, which influence your iodine as well, and the conversion of T4 to T3. They can influence your SLC genes, again, interconnected with iodine. And then separate from that, completely different category, is genetics influence your risk for autoimmune thyroid issues, whether it's Hashimoto's or Graves'. There are multiple genes that influence this risk. One of the main ones, or a couple of the main ones, are your genetics responsible for glutathione assimilation. So glutathione combats inflammation and oxidative stress. When we can't produce enough of it endogenously, we're at increased risk for autoimmune issues. HLA genes in general put you at risk for autoimmune disease of any kind. Doesn't really matter which one. PTPN genes also influence risk for Graves', but even Hashimoto's. And so there are multiple pathways that put people at risk, often that are influenced by antioxidant, anti-inflammatory compounds. So pretty fascinating. Genetics are not the end-all be-all. However, you can manipulate things to try to make those genes work better or compensate for them, which, I'm a little curious. Maybe the reason so many people need T3 at this point is maybe the genetics responsible for converting T4 to T3 are slowly breaking down in society, and we're leading to more and more issues with those genes, and we have to compensate for them by including T3 in people's thyroid management.